These are the things I would not do as a cardiologist. First one is smoking. There's no secret. Smoking is one of the worst things that you can do. In fact, secondary to hypertension, smoking is the most common cause of preventable diseases, things like COPD, but can also cause things related to the heart disease, heart failure, can be a cause of someone having a heart attack, someone having a stroke. But once again, with the lungs, the leading cause of lung cancer. And the second one is not just smoking, other types of drugs, especially illicit drugs, cocaine, heroin, all of these leads to not just heart disease, specifically high blood pressure or heart attacks, but can also cause dangerous infections, life-threatening infections in the valves. This is known as endocarditis. And the third thing is not following up with your medical provider. A lot of these things that we have in regards to heart and health can be prevented if we're having our routine follow-up visits at least once a year, sometimes even twice a year, depending on if you have any risk factors. With this, having discussions with your family members, making sure that you're not at risk of having something like a heart attack in the future, especially if there's a strong family history of this. In addition to that, not understanding what risk factors for overall poor health, including things like high blood pressure, diabetes, obesity, sleep apnea. I believe sleep apnea is one of the biggest things that gets underdiagnosed and undertreated. The fourth one, living a sedentary lifestyle. Our recommendation is 150 minutes of moderate activity each and every week. You can split this down to 30 minutes a day or 50 minutes a day. If you do 30 minutes, ideally 5 days a week. If you do 50 minutes, 3 days a week. What I actually care about that's more important is consistency. If you can only allocate doing 15 to 20 minutes a day, do that. If you can only allocate doing 10 to 15 minutes a day, do that. But also watch what you're eating, watch your nutrition, and be consistent with it. Understand that it's not going to be something that is in 1 week that you're going to see these changes. It takes consistency, several weeks, months, even upwards to a year. And the fifth and final one is stress management. Now, it's a lot easier said than done because you cannot affect the things that are happening in your life. You cannot affect certain things that you were born into, certain scenarios that you were born into, but understanding that stress plays a huge impact in our lives. So ways that you can battle against that or battle the stress is making sure that you get adequate sleep, making sure that you're exercising, and making sure that you're finding ways to de-stress, finding ways to do things that make you feel happy, whether that is exercising, but things like yoga, spending time with family and friends, etc. Making sure that you not just take care of your body physically, but also take care of it mentally. My name is Dr. Isang, and if you got any benefit in that, you know what to do. But if you don't, it means to leave a comment to let me know what things are you working on to better your life.